1955, my mother chose Christ Hospital to give birth to me. So I have a little bit of a soft spot for Christ Hospital. My primary doctor is from Christ Hospital. You know, I was just sitting here listening to the charges or allegations on Prime, a company that's being investigated by the Attorney General of California, the FBI, for charging for services that they didn't do. And I don't know, I guess in some respects, probably the right company to come to Jersey City. In all seriousness, these are tough times. Everybody has problems with healthcare. If you're working for a company, you're self-employed, what you pay out of pocket when you go to a hospital or a doctor, these are hard times. We all know that the Meadowlands was sold off. We know that Greenville Hospital was closed. It's going to become a charter school. We know that Bayonne was sold off to a private group. We know that Hoboken they tried to keep it open as a city hospital, but that didn't work, and that was sold off. What does that mean? It means that there's only four nonprofits left in Hudson County. Palisades, up in Edgewater, and the Jersey City Medical Center. The Jersey City Medical Center will then be responsible to take the full load of charity care. Now, I understand, Mr. Kelly, that your letter to the Jersey Journal expressed that charity care would still be continued. But I'm not so sure how much, for how long, or how well it will be done through a for-profit. I do know that the only nonprofit that will take all the charity care is the Jersey City Medical Center, for Bayonne, for Jersey City, for Union City, and that is a lift that may sink the Jersey City Medical Center. It's an issue that is a concern for the people of Jersey City and the county. I'm not here to say that the sale should not go through. I'm not here to say that it should not be stay a nonprofit or for-profit. I'm here to say that the process should be a public process. It should be a public process where it's transparent, that everybody knows at the end of the day, is this a good deal? Is this something that the people will be able to live with and have their health care? We are not a rich community. We are a community that is struggling under these economic times, and the people cannot afford to wind up in a hospital that is an out-of-network hospital and then thereby causing them to pay more out of pocket. That's what happened to me when I went to the Bayonne Hospital. When they canceled out their insurance policies and renegotiated, in between I had to go for something with my arm, and because it was out of network, I wound up paying a hell of a lot more money than I thought it would. That's a concern. The concern that I think is most troubling is when I read the Attorney General's letter requesting more information from both the hospital and from Prime, that it was a private deal and the information cannot be disclosed. I'm a little worried about that. As I said, I think it has to be. It absolutely has to be a public disclosure. We're all adults here. We don't want to see Christ Hospital close. We do not want to see another facility go by the wayside. But we also want to make sure that this is the best thing for the community. It's a staple of the community. It's an anchor of the community. We need to know what's going to be the future. For instance, I find it incredible that the deal is only for 5 years. It's a hospital. Why only 5 years do you guarantee that it'd be operating? I mean, Hoboken, Bayonne guaranteed much longer. There is the issue of the sale leaseback. It is becoming more common in facilities like senior care, hospitals. There's really a commercial real estate deal where an office building would sell off their building and lease it back. I looked up on Medical Properties website. They're very proud of going around the country and doing these deals with prime being about 20% of their revenue. But on their website, they say one of the things they make sure of is that they guarantee their investors a 10.5% return on their investment. And how do they do that? With long-term leases with the operator of the property. So it's kind of weird that the company that's going to buy the property and lease it back is expecting a long-term lease, but the company that's buying to operate is only guaranteeing 5 years. I need to know what the answers to these questions are before I can actually make a rational decision to support you and not to support you. And I think everybody in this audience feels the same way. I believe that people in Jersey City always will go to the nth degree to help each other out. They will stand up for you if you do them right and explain this out in public. I would highly recommend to you, to Prime, and I'm very disappointed that the Attorney General's office and the Office of Public Health are not here to listen to the community. But I would ask that the process be slowed down. Now, I understand that you're saying we're going out of business. But, hey, you've been around for 140 years. You're not going out of business tomorrow. You can slow this process down and open the process to the point where everybody knows the information. Primes deal with medical properties. Primes deal with the hospital, what they guarantee, and most importantly, I would strongly recommend that you increase the time. Instead of 5 years, I mean, it should be at least 15 to 25 years. Then we know we have a hospital. That's my point.